Good morning, everyone. My name is Jessica Lopez, Communications Coordinator at United Ag. Welcome to our last Health Chat session of the year. And as always, we have Dr. Rosemary Koo again with us to share her insights on PCOS and its effects on women. Rosemary?
Thanks so much, Jessica. Hi, everyone. Good morning. Thank you for joining us. Before we get started, I just want to thank our sponsors, Cyene, Blue Shield of California, Single Point Insurance Services, and Elite Medical. Thank you for supporting our webinar series. And as Jessica mentioned, we're going to be covering polycystic ovary syndrome, or PCOS, today. And I'm going to first be going over an overview of what the condition is, common symptoms associated, as well as some management strategies, who you would want on your care team, United Ag resources, and I'll also leave plenty of time at the end for Q&A. So at the end, or actually throughout the webinar, you can actually type in your questions in Q&A. We can get to them at the end, or we can try to have people actually speak at the end. So it's really up to you and your comfort level, depending on how you want to ask those questions. All right, first of all, so what exactly is PCOS, or polycystic ovary syndrome? It's actually a complex endocrine or hormonal condition that ultimately prevents a female from ovulating regularly. And there are a bunch of different kind of hormonal imbalances associated with PCOS, but the two main ones are elevated androgens. And androgens are male sex hormones, which you don't necessarily think of when you think of the female body, but there's actually low levels of androgens in female bodies that it's actually very healthy. We need low levels of androgens, such as testosterone, for mental health, for proper sexual functioning. And so we have low levels compared to men, but in PCOS, those levels of those androgens or male type sex hormones are elevated. The second kind of hallmark hormonal imbalance in PCOS is insulin resistance. So if you've joined any of our webinars on diabetes, you would have heard me talk a lot about insulin resistance. So insulin is the hormone that helps your body regulate blood sugar. And so in conditions like prediabetes or diabetes, your blood sugar starts to rise because the body doesn't listen to insulin as well. And so your body has to produce more and more insulin to be able to control your blood sugar. And at some point, for instance, in type 2 diabetes, your body can't keep up anymore. It can't produce nearly the amount of insulin it needs to control your blood sugar, and then your blood sugars get elevated. In PCOS, it doesn't necessarily mean that your blood sugars are out of whack, but what it does mean, the insulin resistance, is that your body is not listening to insulin well in PCOS, and therefore your body's producing a lot of extra insulin. And that can cause a whole lot of other conditions, as well as chronic conditions related to insulin resistance, such as diabetes. PCOS is actually more common than you might think. It affects about 10% of women of reproductive age. And the diagnosis might seem fairly straightforward, but it's actually pretty complex. The diagnosis is usually by, there are actually a few different shades of variations of diagnostic criteria, but the Rotterdam criteria is the most often used one. And essentially, it's if you have two out of the following three conditions, then you are diagnosed with PCOS. And those three possible conditions include irregular or absent periods, hyperandrogenism, which means that you have elevated androgens, as we talked about, and then visible polycystic ovaries, at least one, it can be one or both, on ultrasound. And on the right part of the slide here, you can see there's a picture of a normal ovary of what that should look like on ultrasound, and on the bottom is what a polycystic ovary would look like. Now, the name polycystic ovary is actually a little bit confusing because these black circles that you see here are not actually cysts. They're actually follicles. And follicles contain maturing eggs. And so in polycystic ovary, in that bottom picture, there's just more follicles. And they're a lot more and they're immature and they're smaller than in the normal ovary above. This is to differentiate from actual ovarian cysts, which can be inside or actually outside of the ovary. These polycystic ovaries in PCOS are actually all inside because these are actually follicles and not technically cysts. So that's a little bit confusing. Ovarian cysts are separate actually from PCOS. These little fluid-filled circles are follicles in PCOS. No, we actually don't know exactly what causes PCOS. This is actually something that needs to be studied a lot more. But the main risk factors include genetic risk factors. It tends to run in families, especially if you have maternal people in your family, females in your family that have PCOS or even type 2 diabetes can actually be a genetic risk factor for PCOS. There are other environmental factors, such as exposure to certain chemicals that could alter your hormone balance. Also, if you're exposed to a lot of inflammatory foods, that can also eventually lead to PCOS. And then lastly, lifestyle risk factors don't necessarily cause PCOS on their own, but can increase risk if you have a family history or have been exposed to something that might have disrupted your hormones in the past. So, poor lifestyle risk factors like eating a lot of processed foods, not sleeping well, high stress environments can make PCOS worse if you have those risk factors to begin with. So, there are a few surprising facts about PCOS that I want to make you aware of. So, as I mentioned earlier, it affects about 10% of women, but most of those women actually go undiagnosed. The condition can start as early as adolescence, but a lot of people actually don't talk to their doctor about the symptoms that are experiencing, or they feel like it's a normal part of womanhood to have irregular periods. And most women actually don't get diagnosed until they're trying to get pregnant. Um, PCOS is the leading cause of female infertility. So if you're having trouble getting pregnant, you might go to your gynecologist, and then they finally diagnose you with PCOS when you've actually might have had PCOS for decades. And it's actually important to get diagnosed earlier on for reasons that we'll talk about. Also, as I mentioned before with the criteria, one of the possible criteria for PCOS is having those polycystic ovary morphology, or kind of the shape, the visual that you saw in the ultrasound. The tricky thing is not all women actually have ovaries that look like that. None of them they don't necessarily have to have the polycystic shape on ultrasound to have PCOS. And then the opposite's actually also true, is that many women actually have ovaries that look like they have those little cysts, but they actually don't have PCOS at all. And in fact, up to quarter of healthy women with normal periods have ovaries that look like they have PCOS, but they don't have PCOS, and it's actually not a risk factor for developing PCOS in the future. So the presence of that kind of the small, tiny, dark circles within your ovaries isn't necessarily a slam dunk diagnostic feature of PCOS. The symptoms are actually very important into helping your doctor figure out what condition you actually have. Um, and lastly, PCOS is an important risk factor for serious cardiovascular conditions and cancer. So as I mentioned, not only is there elevated male sex hormones in PCOS, but there's also insulin resistance. And insulin resistance is a huge risk factor for cardiovascular conditions. And I bring up this last point because a lot of women with irregular periods or few periods, if you don't have really any other side effects other than that period irregularity, you might feel like it's okay. It's like, hey, like I might only have 3 or 4 periods a year. That's kind of, it's almost like a blessing in some respects. But even if it feels like you're managing that period irregularity, because of the other potential long-term effects of PCOS on your other health systems, it's important to talk to your doctor about it and manage PCOS, even if you feel like it's not impacting your lifestyle or quality of life as much. All right, let's talk about some of the common symptoms of PCOS. PCOS is considered what we call clinically a heterogeneous condition, meaning that everyone has very different kind of range of symptoms. So if you have PCOS, you might have some of these symptoms, maybe one or two, maybe all of them, or your symptoms might be very different from what's on this list. But these are kind of the most common symptoms related to PCOS. The first is irregular or absent periods. You could possibly go months without a period, maybe only having a few periods a year, or have no period at all. And that's because of the hormonal imbalance that prevents regular ovulation in women with PCOS. But when your period does come, it could be heavy and very painful. And as I also mentioned, PCOS is a huge cause of infertility. Because you're not ovulating regularly, you have a lower likelihood of getting pregnant with each cycle. There are actually a lot of hair and skin changes that can happen in PCOS, and oftentimes this is the reason why people actually go to their doctor. It's because they start noticing some of these. And these are related to the elevated androgens. So, for instance, hirsutism is a clinical term for this picture on the left over here. And hirsutism is basically elevated or overgrowth of hair on women in a male pattern. So it's basically hair growing on women that you would expect to see on a man. So, for instance, along the chin, maybe on the upper lip area, on the chest, abdomen, and back. So, all those areas where women don't normally have hair and where you would typically expect to have hair on a man, that's called hirsutism. Unfortunately, PCOS can also lead to hair loss from your scalp as well. You could also experience hair thinning in certain areas. The elevated testosterone can also increase acne in women. And as a result of insulin resistance, there can be a skin condition called acanthosis nigricans. Acanthosis nigricans you can also see in prediabetes and diabetes as well. And this is related to the elevated insulin levels and insulin resistance that causes a thickening and hyperpigmentation of the skin in certain areas, including the skin folds. So it's usually along the neck. It can also be in the armpits and groins. I've actually seen this even in pediatric patients. So kids that actually are developing pre-diabetes early on in their adolescence, their parents will bring them in because they say, like, I keep on trying to scrub my kid's neck and it's always dirty. It's actually not dirt, it's actually acanthosis nigricans related to the insulin resistance. There are also a bunch of other symptoms include weight gain or trouble losing weight. You could feel like you're doing everything right, eating a healthy diet, trying to get enough sleep. But because of the hormonal issues with PCOS, it can be very difficult to lose weight. And that weight often tends to actually gather around the belly. So it's not necessarily weight that's distributed all over the body, but really focuses on your belly. So that apple shape is very common in PCOS. And also, you might have elevated blood glucose, elevated blood pressure, and cholesterol. So, a lot of women with PCOS come in and they think, hey, I'm really too young to be developing prediabetes or having high blood pressure. And they think they're confused because they're like, I've been doing everything right. I've been trying to live a very healthy lifestyle. But a lot of these metabolic issues, like the blood pressure and cholesterol, are not related to lifestyle at all for someone with PCOS. It's related to the hormone imbalance. And then lastly, as a result of the hormones in addition, you can have mood swings as well as mental health challenges, including anxiety and depression. So, as I mentioned earlier, it's really important for women who have PCOS or any of the symptoms that I just talked about to ask their doctor about them to see if it's PCOS. Is it a sign of some other condition? Because if it is PCOS, there are actually long-term consequences of untreated PCOS. The first is elevated risk of chronic conditions related to insulin resistance. Now, more than half of women with PCOS develop prediabetes or diabetes by age 30, and women with PCOS have 7 times higher risk of heart attack compared to women who don't have PCOS. So the earlier you know you have PCOS, the more you know that you have to get your annual screenings, the more your doctor will be on top of you to make sure you're always getting screened for diabetes, high blood pressure, cholesterol, etc. Because you know that you're at higher risk, your doctor knows that are at higher risk, you're going to be more diligent about making sure you don't develop those chronic conditions, or if you do, you're more diligent about managing them. Also, long-term wise, PCOS does affect fertility. And so, as I mentioned, a lot of women don't realize they have PCOS until they're trying to get pregnant. Now, if you know earlier that you have PCOS, you can kind of try to plan for it or try to regulate your hormones earlier. It's because sometimes it could take a year or even a few years or more to try to get that hormonal regulation to optimize your body for pregnancy. So if you know you have PCOS, you can work on that earlier if you know you're going to want to have children in the future. PCOS also increases your risk of endometrial cancer by up to 3 times. This is because if you're not having regular periods, the lining of your uterus is not being shed regularly. And also some of the hormones involved PCOS also can trigger overgrowth of those cells of the uterus lining. And this is why endometrial cancer risk increases by so much. And then lastly, this is often not talked about with PCOS, but it is a risk factor for anxiety, depression, also especially poor body image and eating disorders. A lot of women with PCOS often feel really defeated because of the hyperandrogen symptoms, maybe the overgrowth of facial hair that they're experiencing, or the trouble losing weight, not feeling that their body has the shape that they want to have. A lot of that can develop body image issues and also disordered eating patterns. Now, managing PCOS is not one size fits all. Everyone with PCOS has a very different experience with the condition. And so you want to talk to your doctor about your own health concerns, your health goals, whether or not you need help losing weight, you want to optimize your health to prevent chronic conditions, or you want to optimize your body for pregnancy. All of those goals and your other health conditions need to be considered as you figure out the best care plan for you. One of the first line treatments for PCOS is hormonal birth control, usually the birth control pills. And this helps you get on a more regular cycle and helps with regular ovulation. There are some issues with birth control. A lot of women have negative side effects from it. And so this is something that's often tried first. And then if you have any concerns, it can be, you can switch to different brands or different formulations to see if that helps. But this is often the first line treatment for PCOS. Other medication options include anti-androgens, which are medicines that block or reduce the level of those male sex hormones. You can also use drugs that are targeting insulin resistance, such as metformin, which is a diabetes drug. And even now, actually, there's a growing trend of using GLP-1s, the weight loss drugs, such as Ozempic, to help with PCOS, to target that insulin resistance. That's not widely used now, but I'm starting to see some endocrinologists and gynecologists use that. Also, if you are trying to get pregnant, you're going to want to talk to a specialist about fertility treatments. And mindful weight management is an important part of really anyone who has PCOS. What I mean by mindful weight management is that if you're overweight or obese, weight loss as little as 5 to 10% could help improve PCOS symptoms. However, if you do anything too drastic, like say you go on a water fast or a cleanse for a prolonged period of time, or you're over exercising, you're actually stressing out your body. So a lot of these fad diets out there actually will put more stress on your body, which will worsen insulin resistance. And you don't want that with PCOS because you're already insulin resistant. You don't want to make that worse and put more stress on the body. And so I do recommend, if you want to try to lose weight and have PCOS, it's actually best to work with someone like a coach to help make sure you're doing it in a very mindful, sustainable way that actually calms the body down instead of adding more stress. And some of the lifestyle changes to focus on would be making sure you're getting an anti-inflammatory diet that's really rich in a lot of vitamins, minerals, nutrients, and that's also low in processed foods. So that means like low in processed sugars, low in refined grains, refined fats, all that kind of stuff. Anything that's like packaged in a box that doesn't look like an ingredient that occurs naturally would be highly processed. So you want to stay away from those kind of foods. You want to make sure you're getting plenty of quality sleep because that will help with the insulin resistance. Make sure your stress is at a manageable level and then moving consistently. It doesn't have to be super intense physical exercise. In fact, that could actually backfire for someone with PCOS or insulin resistance, but it has to be consistent. Whatever consistent movement feels good for you. Now, there are a few considerations for who you would want on your care team if you have PCOS. The person that you would really want to focus on is your primary care provider. They might be the first one to help you try to manage PCOS. You don't necessarily need a specialist right away with PCOS if you're not trying to get pregnant. Oftentimes, your primary care provider can start trying to manage you, maybe try those oral birth control pills first to see if you can get your cycle regulated. In more complex conditions, or if you are trying to get pregnant, you'll want to certainly involve your OBGYN. And if you do want fertility treatments, you'll need to talk to a reproductive specialist about that. But regardless, you want to make sure your OBGYN is on board, is aware that you have a PCOS diagnosis. They can even help you get diagnosed and maybe work with that primary care provider on developing your care plan. For some people, you might need an endocrinologist. This is with really difficult to control PCOS, or actually early on, and like if you're an adolescent with PCOS, you might actually just work with a pediatric endocrinologist first, actually. So it really kind of depends on kind of your goals of care and kind of your stage and, whether or not you are looking at family planning in the very near future. You'll want to make sure that you get enough support for lifestyle coaching. You don't have to go through this alone. It's the condition itself is complex enough. Please ask for help, reach out for help. There's plenty of resources to help you, sleep better, eat better, that we have that are absolutely free for you at United Ag. And also, mental health support. Emotional and psychological stress is a huge part of making that insulin resistance worse. And so making sure you're in a good standpoint from a mental health perspective will help you with your PCOS actually. And you don't necessarily need a mental health diagnosis. You don't necessarily need to have severe anxiety or depression. Just not feeling great or feeling kind of irritable, off balance is enough for you to, seek out mental health support. You don't need to wait until you're in crisis or in a more severe state for that. And lastly, at United Ag, our health and wellness centers are an excellent place to get your primary care. They are really on top of health screenings. So if you have PCOS, remember you are at higher risk of type 2 diabetes, hypertension, heart disease, etc. So you'll want to make sure you get your regular health screenings. And then there's free one-on-one nutrition and lifestyle coaching through our health and wellness centers. And of note, now that we have virtual care through our health and wellness centers, in addition, you can either go see them in person or even do a quick phone or video call with them. So there's really no excuse not to access these free resources. You also have Teladoc available to you. If you're having like in a special difficult period or something acute is happening in your body that could actually be related to PCOS and you're not really sure, Teladoc is also a great kind of first line clinician to get a hold of to get some immediate feedback. Um, we have Spring Health for mental health. As I said, get involved with them early. It's better to kind of, have even maintenance mental health visits instead of waiting until you're in crisis or feeling really bad. And if you have any questions as far as accessing OBGYNs or fertility experts in your area, or want additional help finding the right providers for PCOS, you're more than welcome to reach out to United Ag Member Services. All right, I just threw a whole lot at you regarding PCOS, but would love to open the floor for any questions. I guess in the meantime, while waiting for questions, Jessica, do you want to provide any announcements?
Yes. Sorry. Yes, I do. I just wanted to give everybody a heads up that we have new Health Chats episodes and topics coming next year. So stay tuned for that. And also to follow us on social media. We are on all the major social media platforms. And also for email to sign up for email newsletters where you can get all the updates so you don't miss out on any of our sessions.
Great, excellent information. In the last few minutes here, are there any questions? All right, it looks like we got one that chatted in. The question is, I might have missed the first part of it, but my question is, besides symptoms, is there any other way to be diagnosed? Yes, actually. So one of the diagnostic criteria, the elevated androgens or male sex hormones, it doesn't necessarily have to be by symptoms. It could potentially be by blood tests of the male sex hormone levels. Um, the reason I'm a little bit hesitant to recommend that is you often need a specialist to interpret the results of that test because our hormones fluctuate throughout the day and it could even, throughout our cycle and everything like that. So determining what's a normal or abnormal level of those hormones can be quite difficult. But yes, in addition to clinical symptoms, you could actually get blood tests to see your hormone levels. Great question. Here's another question. How do I go about getting diagnosed if I have most symptoms? What would I say to my doctor? I think the best route here is to just say it all. Don't worry about overwhelming your doctor with this. I think it's important to mention everything and anything that you can think of here. To have that full transparency because it could be PCOS, it could be something different. But having all that information about everything you're experiencing can help your doctor make a judgment on what the likely diagnosis is. So go ahead and make a list. Oftentimes writing that list out of symptoms ahead of time, or even emailing it to your doctor ahead of time might help them plan for the visit a little bit better. But, just go ahead, explain it all to them, especially if you've had like a history of ongoing symptoms. It's okay to just tell them all of it. Any other questions? Alrighty, here's another question. Can my hormones be okay as they have been? Wait, let me see. Can my hormones be okay as they have been when checked, but because I have the symptoms, we take something to help? I'm not sure I totally understand the question. Maybe it's, I think that this goes back to the interpretation of the hormones can be really tricky. So you might need actually to be checked a few different times and potentially even, here, I think this is a clarification. When my hormones are checked, they're normal apparently, but I have all the symptoms. Gotcha. Okay. That makes sense. Yeah, this can be really difficult because depending on when the hormones are checked, it could be you might need a few different checks at different times of day to really understand are your hormones truly normal or not? Because they might fall in what's considered the normal category, but if the context of, if it's a different part of the day or a different part of your cycle, it might actually be abnormal. Um, it's also, if you have the symptoms, you might actually have PCOS and it might not be showing up or on the lab interpretation. So this kind of goes to the provider, and that if you feel like you're not getting the right attention from your provider, it might be worthwhile getting a second opinion on this. I hope that answers. That's pretty complex. It's hard. It's a hard situation to be in. Any other questions? If my 18-year-old is having symptoms, should I find her a gynecologist or tell her primary doctor? Yeah, great question. 18 years old is kind of on the cusp. Um, it's probably easiest to start with the primary care doctor, and perhaps that primary care doctor can either start trying treatment, which is usually birth control pills, but the primary care doctor can also potentially refer to an OBGYN that they like for that age group. So it's probably best to start with the primary care doctor, but you might end up getting over to a gynecologist sooner rather than later. All right. Any other questions? These have been really great questions. Okay, here's another question. Is PCOS something that can be reversed, or is it something you have to deal with for life? Oh, you didn't miss this at the beginning. That's totally fine. PCOS, medically speaking, it's not considered something that can be reversed. However, for some people, especially if you have the milder forms of PCOS, like it's really on a spectrum. Everyone has a very different experience. So if you have more mild PCOS, potentially you could manage the symptoms or improve the symptoms greatly from lifestyle management. It might not cure everything completely, but technically it's not something that can be reversed, and is something that is really considered uh, that's something that you have throughout your reproductive years. Great question. Any other questions? Nope. All right. Well, thank you all for joining us today. Really appreciate your engagement. And the big headline here is if you think you might have PCOS, make sure you talk to your doctor about it, get care, and diagnosed if you do have it. All right. Hope you have a great rest of your morning, and I'll see you in the new year.